All right, so public health specialist and core public health functions, policy development. So developing Healthy People 2020. Assurance, so ensuring that activities meet public health goals. So you're constantly looking at data, discussing metrics, evaluating. You want to develop partnerships between public and private agencies, and you want to promote knowledge and behavior that support and improve public health. Maybe evaluating your public school systems, scoliosis screening. So public health and community health nursing versus community-based nursing. So community-oriented public health nurses are community oriented and population focused, right? So you're looking at the community as the client. Community health nurse applies to all nurses practicing in the community. So you provide direct personal services, client's home or clinic environment. And that's fine. You're working within the community and focused on the individual at the community level. So it's really important that you understand that. So some of you might work in the community health nurse level, while some of you are going to be in a community-oriented setting. And some of them are mixed, right? So arenas for healthcare practice, you have clients living in the community, clients in institutional settings, which is not really what we're talking about, and then community-oriented practice. So prevention has the greatest impact on majority. So when you guys are looking at sites or talking about your clinical, even if you're working in home health, when you're discussing about the interventions you're implementing, it's not just about tertiary care, right? So someone has a wound, that's great, but that's not about community health, right? But perhaps about hand washing to the family to prevent the spread of infection. Perhaps encouraging flu shots, encouraging, vaccines. And then your interface in between health and environment and prevention practice is what's most likely to flourish. So there's public health nursing specialists, so they're community and population focused, and public health staff nurses and community health nurses are community-based. They're clinically oriented to individuals, and they'll sometimes combine preventative population focus with direct care and programs. Both of them are still very important. So now we're going to the next chapter. All right, so we're going to quickly go through the history of public health and public and community health nursing. So we're going to interpret the focus and roles of public health nurses through the historic approach, trace the ongoing interaction between the practice of public health and nursing, and discuss the dynamic relationship among changes in social, political, and economic contexts and nursing practice in the community. We're going to outline the professional and practice impact of individual leadership on population-centered nursing, especially the leadership of Florence Nightingale and Lillian Wald, identify structures for delivery of nursing care in the community, and recognize major organizations that contribute to population-centered nursing. So threats to health change, but foundational principles and goals of public health remain the same, right? So we have lots of communicable diseases that are controlled in the U.S. Diphtheria, cholera, typhoid fever. And then there's others continue to affect many lives around the world, right? There's still cholera outbreaks, there's typhus outbreaks, there's diphtheria outbreaks, especially after flooding for cholera and diphtheria. And then we have issues with HIV, polio, and tuberculosis. We still have little pockets of outbreaks of tuberculosis in crowded populations in the U.S. HIV is still, a concern, but it's not the spreading epidemic that it is in other parts of the country, or that it was the world, or that it was here. And then polio is essentially eradicated here in the United States. Health concerns are international. There's re-emerging communicable diseases, and now that it's so easy to go from country to country, epidemics that happen in other parts of the world are concerning for us here, and that's really important to remember. So after the American Revolution, the United States Public Health Service started in 1798 as the Marine Hospital Service. There are some early experiments in providing nursing care at home, so the Ladies Benevolent Society, Philadelphia Lay Nurses, and then Roman Catholic Sisters of Charity. And then the Shattuck Report came out in 1850 by the Massachusetts Sanitary Commission. So Lemuel Shattuck made a report of general plan for the promotion of general and public health based on a sanitary survey done in Massachusetts in 1850. It's a fundamental document in public health. It was the first systematic use of birth and death records, and then also the use of demographic data, so actual surveying of data to describe the health of a population. So this is, one of the first documented epidemiologic studies in the US. And the recommendations became the foundation of how we have a sanitation department in the United States. And because of it, life expectancy increased from 25 years in 1850 to more than 75 years by the year of 2000. So you can look that up because it's really important. So Florence Nightingale, the love, Nightingale and the origins of trained nurses. So Florence Nightingale, Our Lady of the Lamp, saw the need for nurses, right? So the origins of organized nursing, Pastor Theodore Fliedner, the Crimean War. Florence Nightingale improved outcomes based on population approach. And the principle of nursing is health of the unity is health of the community. So there's a difference when we think sick nursing, which most of us did when we graduated, versus health nursing. So talking about the importance of proper nutrition, rest, sanitation, hygiene, those are all essential foundations in prevention and promotion and should be the forefront of our focus in healthcare. But the majority of our money in healthcare goes toward acute and tertiary care. So William Rathbone, 1st District Nursing Association, Liverpool, England. They both, him and Florence Nightingale, promoted nursing in the home and district nursing throughout England. So districts had nurses that went and checked on everyone and reported issues with the population and with the individual. Look up Call the Midwife. There's really great information on it. So America needs trained nurses. Obviously, we talk about this all the time, but in public health, there's increase of women in the workforce and economic advantage of home visiting nurses. So organized nursing, 1870s, Florence Nightingale made a model for nursing school. In 1877, we had the Women's Board of New York City hired Frances Root to form nursing schools. 1878, Ethical Culture Society of New York hired 4 nurses to work in dispensaries. And then in 1885 to 86, formed the Visiting Nurses Association, which we have to this day. So district nurses and settlement houses. So with the Industrial Revolution came, lots of immigration. There was tenement housing, which is what we call now projects, and sweatshops. And district nurses would go in, and Lillian Wald, who is this amazing hero, and she saw the appalling conditions of these places: tuberculosis, kids with scabies, cough, people cooking open fire in a closed room, and kids with asthma, and then also these sweatshops, these dangerous conditions people were working in. And so she helped start the Rural Nursing Service, which was also going out to farms and places to provide care where nobody got care. You only saw a nurse maybe when you were born, when you died. And then occupational health, which was going in and observing working environments and how it related to health. So school nursing in America. So school absences due to infection and communicable disease was becoming a problem. Lena Rogers was the first U.S. school nurse, and she found that illness is not often the reason for absence. And that also helped understand the welfare of children in our country. Maybe mom and dad got drunk and they couldn't drive kids to school. A child didn't have clean clothes, so their parents wouldn't let them go to school. They need to stay home and watch the younger children, which is an inappropriate reason to keep someone home from school. And it had a significant and positive impact among the young. And so more nurses were hired and school nursing spread to major cities. So school nurses are really important. And there was this stint in our society where we were cutting school nurse program.